Hello, my name is Matt Jernigan, and I will be talking about my SBAR today related to baby place. Today I was placed in Antepartum unit with helping to take care of a female patient that was 26 years old. Her gravida was 2, para 0, term 1, preterm 0, absent loss was 0, and living was 1. Prenatal records were available, and I was able to review them. What was her admitting diagnosis says she presented with twins today, and she was actually referred from an office visit, doctor's office visit, in which one of the babies had an absent end diastolic flow and was in the breech position. It's also interesting to note is that the other baby was in the cephalic position, so they were closely monitoring her to make sure that there wasn't any backflow from that baby. Our maternal vital signs within normal limits. Her temperature was 97.8 degrees Fahrenheit. Her blood pressure was 136/60. Oxygen saturation was 95%. Respirations were 16, and her pulse was 88 beats per minute. Uterine assessment, there were no contractions perceived by the patient. Fetal assessment, the fetus did have some moderate fetal heart rate variability at the time of the assessment, although we're trying to hold off on any labor, any true labor for this patient because she was only at 30 weeks and 1 day. But she did have that previous delivery, and in 2019, so last year, she had a delivery at 40 weeks and 3 days. They did use an epidural for that, and she had a complication for that for postpartum hemorrhage, so she is at risk. Membrane status, her membranes were intact, and no support persons were present at the time. So in particular instance with the 26-year-old today, they actually conducted a physical profile, and I was able to witness or actually see the ultrasound that was being conducted there. Ultrasound came back as an 8 out of 8. Baby B had absent end diastolic flow with intermittent reversal of flow. And so what's likely recommended here is a close monitoring of this baby. And I was actually able to look a little bit more into the pathology behind this end diastolic flow, and I actually learned a little bit today about it. It's actually common, it's normal, and not common, but it's normal in early pregnancy up to 16 weeks. But in mid to late pregnancy, it results from placental insufficiency. So the flow in the umbilical artery, it should flow in a sort of a forward direction in normal circumstances, but if there is an increased resistance, that diastolic flow may actually decrease and become absent and might finally reverse. And so when that reverse diastolic flow happens, that's when it's likely that a C-section or some sort of action may need to be taken. And it's likely that she might become a C-section patient because of that breech, that one baby in the breech position, so that baby can't be delivered in a breech position, although the one is in cephalic. So unless they're able to turn that, which I don't know if that's possible. But anyway, related to the associations, the associations related to this end diastolic flow, what's interesting to note is the intrauterine growth restriction, this increased risk of neonatal thrombocytopenia, and there's also an increased risk for necrotizing enterocolitis. So it's useful to have a Doppler ultrasound done to sort of hopefully reduce that to 0 at the end of the diastole. So it's not a very good case for the baby, but I think with proper interventions, and the patient was also on betamethasone, and so the betamethasone is useful to help these preterm babies, help facilitate their lung development, and so really helping to facilitate the lungs if she were had to be induced for labor, or if there was a C-section that needed to take place. really the betamethasone will help. But otherwise, besides that, the patient wasn't on anything else. So recommended to probably monitor, and the C-section is probably likely within the next week or so, especially if that diastolic flow continues to be a problem.